What's up, good people? Today I'm going to talk about a very important thing that runs in our society. It's called prediabetes. And this friend of mine, his name is DJ. So Mr. DJ is extremely worried because he has been diagnosed with prediabetes, and you can look at his face. He is so much worried that he has a flat face right now, no expressions, really sad because he has been diagnosed with something called prediabetes, and he wants to know that what should he do and what sort of diet he need to take so that the prediabetes does not progress into diabetes. First and foremost important thing I would say in this regard is Mr. DJ and anybody in the world whoever has prediabetes, they should stay in touch with their primary doctor. The primary doctor is going to do certain testing on you, like blood sugar testing, A1C, and so on and so forth. All those testing that they do for the baseline are very important because that's how we can manage and we can monitor your progress, that how it is going and what else we need to do in addition to just the dietary control for your pre-diabetes so that it does not turn into diabetes. So let's move on. First thing in your dietary plan or dietary habits for pre-diabetic people is, including Mr. DJ, that thing is a mindful eating. What does it mean by mindful eating? Mindful eating is eating as it sounds, eating with certain logic here that, man, are you eating too much? Are you eating too less? Or are you drinking too much? Are you drinking nothing, like hydration stuff? So all those things include in the mindful eating. You should be mindful of what you ate and what you did not eat, okay? So amongst those, the basic categories that come into this are carbs, proteins, fats, and fibers, and hydration. All those 5 things are extremely critical to be mindful or watchful of when you are monitoring yourself for your pre-diabetic status. And in that regard, I would say let's come to carbs. Everybody should know that if you are pre-diabetic, lower down or limit your carbs, but totally finishing them or stopping all the carbs is not the solution. And they did a research in which they found out that the mortality rate and the complications were pretty much the same between those who cut off their carbs, like 0 carbs, and those who did the mindful carbs in their diet. So be very mindful or watchful about your carb intake. You don't have to cut them down, but be very, very diligent about that. And another very important perspective in that is you need to be, cutting down the carbs in a way that you have lesser and lesser or least amount of refined carbs. Try to take natural diet. Stay away from refined carbs, which is extremely unhealthy if you are a pre-diabetic patient, or even if you are a diabetic patient. Even if you are not diabetic or pre-diabetic and you feel like you might turn into a pre-diabetic or diabetic in future because you have a family history about it and other factors that put you at a risk for diabetes or pre-diabetes, then you should have a watchful, thing on your diet that you are not having a lot of refined carbs. So when it comes to the refined carbs, make sure you're not taking a lot of soda that we take from the market. That soda has a lot of carbs and they are all refined carbs and they're very unhealthy for you, especially if you are a diabetic or a pre-diabetic. So be very, very careful about that. And important thing is in that regard is, besides carbs, you have to be watchful about your proteins as well. Every protein is not healthy for you if you are a pre-diabetic or if you are a diabetic. So take some, very, very watchful or cautious protein diet. For example, you can take egg whites, you can take lean meat, Lean meat is like chicken without the skin, turkey without the skin. Soya beans are really healthy, and shellfish, codfish, crabs, or the lean beef cuts are also okay. But I suggest stay away from beef as much as possible. Chicken or white meat is healthy for you. So be mindful or watchful about your protein intake as well. Another extremely important factor is glycemic index. The glycemic index is a regulatory or monetary factor about how much glucose you have in your body. So some of the foods are high glycemic index, whereas some are low glycemic index. For example, a very good example of a low glycemic index food that you can have on regular basis if you are pre-diabetic is bajra flour. We all take bread, so bread is good, but the bread made with a bajra flour is much safer and much healthier alternative for pre-diabetics and diabetics. For a detailed video on the bajra flour, please stay tuned to my channel. And besides those things, you need to make sure you're taking enough fiber in your diet. Enough fiber in your diet, or excess even, is really healthy for you, because fiber is gonna have lesser stasis. It avoids the stasis of food in your gut, and therefore the food doesn't stay that longer in your gut, and hence you have a lesser and lesser chance of getting higher glycemic levels in your body, or glucose levels in your body, for general terms. There are certain foods like beans or legumes or whole grain cereals or whole grain pasta or whole wheat pasta that's also good for diabetics. So, but make sure it's a whole wheat pasta, not a regular pasta. And some other foods like oats. The steel cut oats are good for pre-diabetics, and beans and corns and non-starchy veggies like carrots are very healthy. Make sure the veggies that you're consuming are not a starchy veggies. High content starch containing veggies or vegetables are not healthy for diabetic people. So please check the ingredients, or please go online and search which of the vegetables are high in starch, or maybe in future I might come up with a video on that. It takes a lot of research and content that I need to go through and present here. So that's why I sometimes take time. Like Mr. DJ has been asking me about pre-diabetes for a certain time period, and I had to go over a lot of research papers, especially in regards to bajra flour and all those things, the type of diets that he needs or all the pre-diabetics need. And then I came up with this video after a lot of educational research papers and all those content. So please like, subscribe, and share to my channel. But let's add more before I finish. Another important thing is stay hydrated. Hydration is very important in your case if you have diabetes or pre-diabetes. Like Mr. DJ needs to be hydrated all the time, because you don't want the glucose concentration to go high. Let's say I have a glass of water and I put 1 teaspoon of sugar in it. So the teaspoon is right here and the glass is all over there, So, but if I have a half glass of water, the proportion of sugar in that glass is more compared to the glass of water that was full to the top. So that's just a layman terminology explanation for the glycemic index I want to go across and explain. But for more details, you can ask me question on that. Another extremely important factor for Mr. DJ or any pre-diabetic, including diabetics as well, is exercise. You have to have an exercise plan. Go to the gym for like 5 times a week and hit the gym for like 5 hours a week or so. If you cannot do that much, maybe 2.5 hours a week. Like that means you do like 30 minutes per day for 5 days per week, something like that. Start building up a good exercise level. That is gonna benefit you a ton. I honestly cannot give you a bigger advice than that. Exercise, 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 exercise. You have to have an exercise plan, but make sure you are hydrated with that and you are not cutting down your glucose level. Like, you don't starve yourself and then go to the gym. No, you don't want that kind of situation, especially if you are diabetic. Even pre-diabetics, be careful. But point is, do regular exercise. So let's summarize. You need to have a good carbs, but not refined carbs, a very good protein level in your body, a very good fiber level in your body, a very good hydration, and a very good exercise plan. If you want to stay away from diabetes, let's say if you have been diagnosed with pre-diabetes but you don't want to turn into a diabetic patient, yes, follow these advices. They're going to benefit you. For more details, stay tuned to my channel. Thank you so much. Bye.